Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at socio-cultural factors and health conditions in Unit 3 VCE HHD. Before we dive into this video, just a reminder, at the Health Resources Hub there's a range of different ways you can engage with us. We've got our YouTube channel where there's over 100 content videos, SAC and exam tips, and if you're on YouTube you can subscribe with the button in the bottom corner of the video there. We'll have new videos coming out each week during the school term this year, so if you subscribe you'll get alerts to all of those new videos. If you're not on YouTube you can just head there and search for the Health Resources Hub. We've also got our website, the hrh.net.au, where there's opportunities for teachers and students, and if you're a Unit 3 and 4 student you can head there and scroll to the bottom of the page and you'll be able to register for our free student newsletter. That's coming out twice a term this year, and you'll get access to SAC and exam tips as well as free resources, and our latest version's coming out in just over a week, so if you head there now you won't miss out on that one. If you'd like to follow us you can see our social media links there, and also our email if you'd like to get in touch. So in this video we're focusing on socio-cultural factors and health conditions. I have done a previous video on biological factors, and as I mentioned in that particular video, 4 different examples of these factors, what you need to be able to do is make links to health conditions, because most likely you'll get a question where they'll ask you maybe to list 1 or 2 of these different factors and then outline how they might contribute to differences in health status or burden of disease, okay, between particular population groups. So that could be low SES versus high SES, or Indigenous versus non-Indigenous Australians. So it's important to be able to make links between these and different health conditions. So you can see there it lists, okay, some of those socio-cultural factors. So socioeconomic status, which you probably know is made up of income, occupation, and also education. But then it does give there that separate example of level of education. It also mentions employment status, cultural background, social networks, and social expectations and attitudes, as well as cultural traditions. So there's quite a few different sort of examples that you can use for sociocultural factors, probably more than there are for biological and environmental. So you can see here that I've taken a couple of those examples. So for example, income level, which is part of socioeconomic status, or education level. And I've shown you how you could make a link between this and a particular health condition. So for income level there, you can see you could talk about if an individual or group has low levels of income, that might mean they're not able to afford timely diagnosis and treatment for their health, and that could lead to a condition such as cancer developing. And so that would demonstrate that you understand how low levels of income could contribute to a health condition. Same for education. So if you have low levels of education, that might mean that you're less informed of the risks of behaviors such as drinking while driving or speeding, and that could increase the risk of a car accident and injury. So there's obviously a range of different conditions that you could link to for these sociocultural factors, and I'm just giving you one there. I have made a table, okay, like this, which I'll send out in my free student newsletter, which goes through about 10 or 15 different examples. So if you're after a few different sort of examples of each of these for different conditions, then if you head to our website and sign up to our free student newsletter, that'll be sent out over the next week. You can see the last example there that I've taken from this table is for social exclusion, and so linking that to anxiety and depression. So this is something that I'd definitely be practicing for the range of different socio-cultural factors and a range of common conditions that come up in health, and add this to your notes so that when you're then being asked to link, okay, from a particular example of a socio-cultural factor to a condition and then onto health status and burden of disease, you can be confident that you'll be able to include that link. Okay, hopefully you found that video useful. Just a reminder, here are the different ways to engage with the Health Resources Hub. Thanks so much.